Disease causing permanent abnormal dilation and distortion of bronchi and bronchioles. Options are A. Bronchitis, B. Bronchiectasis, C. Emphysema, D. Asthma. Answer is B. Bronchiectasis. Removal of a lobe of the lungs. Options are A. Thoracotomy, B. Wedge resection, C. Segmental resection, D. Lobectomy. The answer is D. Lobectomy. Membrane covering the lung. Options are A. Pericardium, B. Peritoneum, C. Perimetrium, D. Pleura. The answer is D. Pleura. Air in the pleural space. Options are A. Pneumothorax, B. Hemothorax, C. Pleural effusion, D. Pneumonia. The answer is A. Pneumothorax. Disorder characterized by destruction of the alveolar valve. Options are A. Asthma, B. Emphysema, C. Bronchitis, D. Bronchiectasis. The answer is emphysema. Inflammation of the pleura. Options are A. Pleuritis, B. Pleural effusion, C. Emphysema, D. Emphyema. The answer is A. Pleuritis. Blood in the pleural space. Options are A. Pneumothorax, B. Hemothorax, C. Pleural effusion, D. Pneumonia. The answer is B. Hemothorax. Expectoration of blood-stained sputum. Options are A. Hemostasis, B. Hematemesis, C. Hemoptysis, D. Epistaxis. The answer is C. Hemoptysis. Collapse of the lung tissue. Options are A. Emphysema, B. Bronchitis, C. Atelectasis, D. Asthma. The answer is C. Atelectasis. Normal breathing is. Options are A. Apnea, B. Hypercapnia, C. Apnea, D. Dyspnea. The answer is A. Apnea. Collection of pus in the lung tissue. Options are A. Emphysema, B. Pneumonia, C. Lung abscess, D. Pneumothorax. The answer is C. Lung abscess. Fluid in the pleural space. Options are A. Pneumothorax, B. Hemothorax, C. Pleural effusion, D. Pneumonia. The answer is C. Pleural effusion. COPD comprises the following except. Options are A. Bronchitis, B. Emphysema, C. Asthma, D. Atelectasis. The answer is D. Atelectasis. The respiratory center is situated in the options are A. Medulla, B. Hypothalamus, C. Cerebellum, D. Cerebrum. The answer is A. Medulla. A potent respiratory center stimulant. Options are A. Oxygen, B. Carbon dioxide, C. Nitrous oxide, D. Hypocalcemia. The answer is B. Carbon dioxide. Removal of entire lung tissue. Options are A. Thoracotomy, B. Wedge resection, C. Lobectomy, D. Pneumonectomy. The answer is D. Pneumonectomy. Total cessation of breathing. Options are A. Eupnea, B. Hypercapnia, C. Apnea, D. Dyspnea. The answer is C. Apnea. A vasodilator drug. Options are A. Sorbitrate, B. Streptokinase, C. Urokinase, D. Metoprolol. Answer is A. Sorbitrate. Electronic device that provides repetitive electrical stimulation to the heart muscle. Options are A. ECG, B. Pacemaker, C. Defibrillator, D. Intra-aortic balloon pump. The answer is B. Pacemaker. A fibrinolytic agent. Options are A. Dopamine, B. Amiodarone, C. Streptokinase, D. Sodium nitroprusside. The answer is C. Streptokinase. Pink frothy sputum is a clinical sign of A. Myocardial infarction, B. Angina pectoris, C. Pulmonary edema, D. Cardiac arrhythmia. The answer is C. Pulmonary edema. A cardiac glycoside. Options are A. Nifedipine, B. Lidocaine, C. Procainamide, D. Digoxin. The answer is D. Digoxin. Elevated potassium level in the blood. Options are A. Hypokalemia, B. Hyponatremia, C. Hypernatremia, D. Hyperkalemia. The answer is D. Hyperkalemia. The most severe form of AV block. Options are A. First degree block, B. Second degree block, C. Third degree block, D. Mobitz type 1. The answer is C. Third degree block. A potent vasodilator that decreases both preload and afterload without directly affecting the heart rate. Options are A. Digoxin, B. Warfarin, C. Morphine sulfate, D. Sodium nitroprusside. The answer is D. Sodium nitroprusside. The most serious complication occurring after cardiac surgery. Options are A. Dysarrhythmias, B. Cardiac tamponade, C. Hypertension, D. Bleeding. The answer is A. Dysarrhythmias. A definitive sign of deep vein thrombosis or DVT. Options are A. Brudzinski sign, B. Murphy sign, C. Positive Homan sign, D. Cullen sign. The answer is positive Homan sign. Paroxysmal nocturnal dyspnea is seen in A. Right-sided heart failure, B. Left-sided heart failure, C. Cardiac arrest, D. Cardiac arrhythmia. The answer is B. Left-sided heart failure. Dependent edema and hepatomegaly is seen in. Options are A. Right-sided heart failure, B. Left-sided heart failure, C. Cardiac arrest, D. Cardiac arrhythmia. The answer is A. Right-sided heart failure. Accumulation of fluid in the pericardium preventing ventricular filling. Options are A. Cardiac tamponade, B. Pulmonary edema, C. Myocardial infarction, D. Angina pectoris. The answer is A. Cardiac tamponade. An oral anticoagulant. Options are A. Heparin, B. Streptokinase, C. Cyanocobalamin, D. Warfarin. The answer is D. Warfarin. A major side effect of lipid lowering drugs. Options are A. Nephrotoxicity, B. Hepatotoxicity, C. Ototoxicity, D. Impaired vision. The answer is B. Hepatotoxicity. A positive Trendelenburg test is diagnostic of. Options are A. Carditis, B. Varicose vein, C. Phlebitis, D. DVT. The answer is B. Varicose vein. If you find the video useful, please subscribe.